Good afternoon, Black Dispatch audience. We are excited today to have a very distinguished guest, Senator Mattie Hunter, who is the Majority Caucus Chair for the third Senate District in Illinois. Senator Hunter, thank you for being with us this glorious afternoon, and I want to also say glad to be here with my co-host Hubert Morgan.
My
I'm,
pleasure,
I'm,
Dr. Kirk and Hubert Morgan.
Okay, well, we thank
Good to
you.
see you guys.
Yeah, it's good to see you and hear you, Senator. We know that there's been a lot of work going on that you've been engaged in recently, and we're gonna try to tap into that a little bit. You've committed to coming back with us to talk more in detail. So we want you to know that our audience hears that, and they're expecting to see you again.
And I look forward to seeing your audience again.
I like that. I like that. That's absolutely fantastic. So let's just jump right into it, Senator. We know that the Black Caucus has been doing a lot of work around the pillars, these four pillars that have kind of initiated the caucus, the Black Caucus pillars that have initiated a number of legislative kind of approaches to things like criminal justice, healthcare reform, economics, education. So I want to talk to you. I know you've been a leader around the health care and human services, and maybe what you could do is kind of share with the Black Dispatch audience a little bit about what are the key objectives and elements of that legislative pillar that you've taken some leadership over, and can you provide kind of a sense to the audience of what it contains and why you think it's so important?
Yes, thank you very much, Dr. Kirk, for inviting me here today. Yes, I was the leader of the Health and Human Services pillar, which was the fourth pillar of the Illinois Legislative Black Caucus. And so we've known, and so the final piece of the legislation was to eradicate racism in the state of Illinois as it relates to health care. And so for centuries, Black people have been disrespected. We've been abused and misused in the healthcare system. Today, Black and brown people have been more susceptible to be infected with COVID, with hospital rates for Black and Latinx and Native people 4 times higher than those of white people. And so institutional racism has caused communities of color suffering from a plethora of health disparities, even before the pandemic came and took the world by storm. And so numerous studies have shown that racism is the root of various health inequities experienced by Black Americans to this day. And so Black Americans suffer at a higher rate of chronic diseases, including diabetes, hypertension, heart disease, asthma, and many cancers. And so we just basically wanted to level the playing field. We wanted better outcomes for our community. We have the Affordable Care Act, and it's Medicare for all or Medicaid for all, and we weren't seeing the outcomes in our community, and so that was one of the several of the reasons why we decided to come up with the Health and Human Services pillar.
so, Senator, let me just ask because, you have a district that goes across Chicago in the most unique way. And I say unique because when you look at the district boundaries, all types of people are in your district. We looked into the legislation that you have, and there are a few areas that really caught us by I say surprise because you would think that in 2021 we wouldn't need to shore up certain of these areas, as you just said. But there are some things. I know people who have sickle cell, as an example. I am just appalled at the fact that people are having to not have sick leave benefits to take care of their loved ones who probably still live with them in terms of their grandparents or in terms of their kids. I mean, so, and then we talk about things like hospital closures. I live on the south side, and some of the hospitals on the south side are the very hospitals that lifted the heaviest load during COVID. And I'm just thinking of Roseland as an example. So can you talk to us about just how impactful a lot of the details came out in terms of affecting Black and brown people?
Yes. You mentioned sickle cell. I had a cousin, she was only 12 years old, and she wound up dying from sickle cell. There has been a major disjustice that has occurred to our community as it relates to sickle cell, hospital closures, diabetes. We are sick. Our family members are sick, and there's no benefits paid for paid sick leave. And so the House sponsor of this legislation is my colleague in the House, State Representative Camille Lilly, and she and I have just basically been focusing on health disparities, different kinds of initiatives. At least all of my 19 years here in the Senate, and we'll pass legislation, and the administration doesn't want to fund it. They'll pass the legislation, the governor will sign it into law, and they'll stick it in a folder or on a shelf and then they'll say subject to appropriation. What is subject to it? The appropriation never comes. And so therefore, our people are getting sicker and sicker and sicker, and they're dying at a very high disproportionate rate. And we just felt that it was so unacceptable. You talk about hospital closures. Mercy Hospital is in my district. Been providing services, for 80 years or so in that community, and that's one of the first place that I would go and other residents in this community. I don't care if they're Black, I don't care if they're Asian, I don't care if they're Hispanic. It's the nearest hospital, and that's where we would go. You would walk in or go by ambulance. And so the owners at that particular time decided that they weren't making enough money, so they were going to close the hospital. And they talked to everybody except for members of the Black Caucus. Other hospitals knew that it was closing. The administrators knew, but we didn't know. They didn't even tell us. And I'm their senator. They didn't even talk to me. But every time you turn around, they're running down here to Springfield wanting more monies from the state, for more Medicaid money and more transformation money, And so the Black Caucus, we got together and we put a brick on it. And we said, you're not getting another dime from us down here.
You say a brick?
Yeah, we put a brick on that. So you're not getting out another dime from us, until you sit down with us and explain to us, why are you wanting to close this hospital, especially after so far you've gotten several $100 million from the state? How can you be broke? You have other hospitals that you're operating. I mean, we had to have some of those frank conversations like that, and the owners didn't appreciate it. They came down to Springfield and they wined and dined us, thinking that that's all that was needed. I didn't even show up because I knew what kind of party it was going to be. So anyway, the fact of the matter is that the hospital is not closed. They sold it to someone else. We're trying to work with them now because the hospital has lost money since they've been phasing down for about a year now. And so they've lost monies, they've lost revenues, they've lost physicians, they've lost key staff, they've gotten rid of most of their major board members that has been sitting on the board for 20 and 30 years. And so we're in a rebuilding phase right now, And so, yes, I was very vocal. We protested and complained to the state, as well as had all kind of major protests to keep that hospital open. We were very successful in keeping it open. Now we need to make sure we put some more resources in there. But anyway, the fact of the matter is that we have a moratorium on hospital closures where we were only able to get about 4 months, that we must keep, that you cannot close a hospital down unless you've notified everybody within a timely manner and appropriate levels of notification is taking place. You just cannot just jump up and close another hospital again, ever in this state.
But Senator, a hospital, one of the last institutions in our communities, if the profit motive is the reason why they stay, as opposed to the health of the community, where have we gotten? Because I know Mercy, I know the communities that are in the Gap, I know communities that are east, the concentration of housing and
Right.
people who are there. I know people west. So you mentioned, all the way from Chinatown, Bridgeport, everyone there, the amount of people who live there,
Right.
there isn't any reason why there shouldn't be the support in terms of the number of people. But if it's only profit, then my goodness.
Well, that's these particular owners. They have owned this hospital for 5 years, and they've never met with me. Matter of fact, I did not know that they had changed the ownership of the hospital until they started talking about closing down, because they had gone around me and they had talked to the governor and the Speaker of the House and the Senate President. And this is how they were able to obtain funds to continue to run in the hospital. And so I found out about it because the state contacted me and asked me, how did I feel about it, And so anyway, that's how that happened. But you see, this community, this group that just left, sold this hospital, they're in business to make money. Their second, third, or fourth priority is health care and keeping people healthy. Their major priority is health care. Last year, we looked at some statistics. And they have 3 other hospitals in the Chicagoland area, and they made over $1 billion among all of those hospitals. So why do you want to close? You didn't make enough billion. You wanted to make $2 billion or $3 billion.
Right.
And then to show you how arrogant they were closing the hospital in the middle of a pandemic. In the middle of a pandemic,
Crazy.
So how dare you?
Yes. Kirk, why don't you ask another question? And I still have a follow-up in terms of my questions, just managing the time.
Yeah. So Senator, you gave really a prime example of the ways in which operators in your district, whether it be hospitals or other institutions, might not be always attentive to the constituency that you're focused on trying to serve.
Right.
And I guess my question is, how do you envision your ability to activate that constituency in cases like this to ensure that they make clear about what their interests are so that they can support you in supporting their interests? So in other words, what are the ways in which you activate that constituency in these kind of situations?
Well, you have to pick up the phone and start calling key leaders in the community, folks that belong to organizations. You have to spread the word. You have to disseminate the information. You have to organize. You have to bring in the unions, because the unions are their members are the janitors and the cooks in the hospital. And then you had other nurses. That's a separate union. They reached out to me. I reached out to them, and we all got involved. We contacted other elected officials, the aldermen, city council members, state reps, state senators, U.S. congressmen. We reached out to all of those elected officials that touch that hospital and its parameters. You see? And you bring everybody together, and you bring block club presidents, and you go down to the grassroots, in terms of organizing key ministers, the faith community. Everybody has to come together so we can address this issue collectively, because anytime you start talking about closing a hospital or any kind of healthcare facility, then we're talking about some major serious problems. And see, this community also is being gentrified, you see. And so, everybody is coming in trying to figure out how they can tear down this building and that building and build a bigger building, and they're buying up parking lots so they can build condos or more high rate apartment buildings. It's like a money grab thing at our expense. And so the taxes, the property taxes are going up in this general area, and so it's just a multiplicity of things going on at the same time, and just trying to keep up with what's going on has been a challenge all in itself.
Right. Yeah, and you raised a question about the gentrification strategies that kind of are yet another kind of burden, if you will, on the community in terms of displacement questions and all those things. How are you managing that, given the confluence? You got this hospital situation, you got these trends that are going on with gentrification. How are you managing that? And what's your kind of sense of strategy going forward to really protect and your community?
So in addition to this health and human services pillar that we passed, I got together with two of my other colleagues, two of my Caucasian sisters, one living on the north side and the one living in the Arlington Heights area. And they're having some issues also with folks moving out of the community, So we came up with some legislation to deal with affordable housing. We're going to build some more housing, but affordable housing everywhere in Gold Coast, downtown, River North, Hyde Park. We took some federal dollars. And we put together a affordable housing omnibus bill. So we're using the federal dollars, about $1 million. Let me see. How much money? It's over a 3-year period. We're putting like $300 million in there for affordable housing. So it'll be $100 million a year in the bill. The governor signed it into law already. We had a bill signing over the summer, and the monies are going to be dispersed through Illinois IDA, Illinois Housing Development Authority. And so it's not a loan, y'all. This is a grant. And we made sure that we put the money. The state has to do business with 40%. They spend 40% of that money with Black contractors. And so that's our solution. That's our solution to addressing the gentrification issue. It's for and then we have the rental assistance program. Where we're using federal dollars, the federal CARES monies, to keep people in their apartments. They're paying out slowly, but most people have been approved already. And the next round is next month, starting in November. IDA, Illinois Housing Development Authority, will start the homeowners piece, where people who are losing their homes, they will be able to apply for this grant money. There's no loan, so there's no need to pay it back or anything like that. But these are immediate ways that we can find and identify to keep people in their homes, rentals and homeowners.
So, Senator, let me just give you some context here. Both Kirk and I are urban planners, right? Okay. So we appreciate so much of what you're saying, both in terms of the stress, both economically and socially, on the very communities in which we're talking about. So when you come back with us, we can have a whole conversation about another one of the you can talk about it as a pillar. We talked about it as systems.
Yeah.
Another one of the systems that are failing us, right?
Yeah.
So right now, though, I have a question for you, because I'm just fascinated at the fact that you represent Bridgeport, and we can talk about the history of Bridgeport, and you also represent Inglewood.
Yes.
What a contrast in terms of the people who walk down the street, whether it's people who are walking down 63rd Street in Inglewood or Halstead and 35th Street in Bridgeport, and what and how they look today. So can you share with our audience the fact that you have to represent and legislate for both of those communities at the same time?
Yeah, well, okay. So my success has been with flexibility. I communicate with people. I don't care what color you are. You know, I'm here to serve. And so I had to get out there, or folks just approach me from these different communities. I started with the faith community as well as the elected officials. Either I reached out to them or they reached out to me, and most of them always need something, so they'll call their office. A lot of people do not know how to access services from the state of Illinois. But the state of Illinois, we fund education, we fund housing initiatives, we fund Medicaid, we fund, alcohol, drug, mental health programs, child welfare programs. We fund everything. We fund cities and townships and municipalities, and so we're bigger than the state of Illinois. The city of Chicago. We fund the city of Chicago. We give them a couple of $1 billion a year. We fund transportation initiatives. All of those construction projects you see where they're tearing up the streets and the sidewalks, the highways, the bridges. Those are our capital projects. Those are capital dollars. The tax credits that the city dishes out. Those are funded by the state that we hand over to the cities to disperse. Okay? And so you just reach out to all kinds of people that are affected in those particular areas, which is everybody, and you find out what their needs are, and we just try to put our heads together to figure out how we can get some resources to these folks. It's a lot of work. A lot of folks don't think we do anything because they don't see us out there in the streets, but we are. I'm on like 11 committees, and since COVID has been here, as we're doing now, we're Zooming, so we literally have been holding hearings for 2 years via Zoom. Very few has taken place in Springfield, where I am now, or downtown Chicago. About 90% of our hearings have been held via Zoom. So I my first priority are to attend the hearings and the committees that I sit on. So, but we're always behind the scenes doing things and making things happen. Long as the state continues to run, we are behind the scenes getting the work done because we're the ones that make it run.
Yeah. So, Kirk, I just wanted to let Senator Hunter know that our objective as part of the Black Dispatch is to be able to ask questions of the person who's on the street, ask questions of the leadership who are there basically to serve and hold not only you accountable, but for the person on the street accountable for knowing how to support the leadership when they come through with legislative pillars like this.
Right.
So I know that Haley has your communication assistant, has helped to pull this together.
Yeah.
One thing that we will ask you is that when we have this episode and when we're going to launch this episode, that we're going to blast it from the mountaintop. We're also going to ask her to be able to blast it through the social media platforms that you have, because everyone should know that the reason why the hospital is still there is the hard work that you have done.
Right.
And we want you to know that the person in the barber shop that we might talk to might have a question for you.
Yeah.
And whatever the question is and the answer is, we need to reach out to you to be able to come back and talk to them about that. Kirk, I'm just looking at time, and I think that we should.
No problem. And I'm willing to come back. Haley is shaking her head up and down. She just wants to blast everything. She's here with me.
Okay,
and
great.
Just know that I did not keep this hospital open by myself. All those different entities, the unions and the community people, SEIU and the Teamsters, and community people, patients, former patients and current patients.
Right.
Even some of the doctors and physicians, they were out there protesting in their scrubs, you know.
Right. Right.
So
Right.
everybody came together to make it happen, including other elected officials.
That's fantastic. Well, Senator Hunter, we want to thank you for your leadership. You've been at it for not quite 20 years yet,
Not quite,
but
not quite.
you're getting in that direction, and we really appreciate the work that you do, and we know how challenging it is. And one of our objectives, as my colleague Hubert says, is to make sure that people understand what our black legislators are doing,
Yes.
and making sure that people appreciate that they can reach out to those legislators, that they're there to serve them, and they should know that those lines are open. They just need to access them.
That's
So,
right. Absolutely.
yeah. So we want to thank you again for all that you do and the time that you spent with us today.
Thank you, Dr. Kirk and Herbert Morgan, for having me here. I really enjoyed myself, and I look forward to coming back.
All right.
And before you sign off, Kirk, I was going to put the senator on the spot, but I don't think I will, because I was going to ask her favorite restaurant in her district. But then somebody would probably get back to her and say, "What about me?" Right?
I know, because I have restaurants in Bronzeville. I have a few in Inglewood. I touch Hyde Park, parts of Woodline, River North, near South. I love them all. I love soul food. I love Thai food. I love Italian. You know.
So I'll have to come and get the list from you.
Absolutely. We lost your picture a little bit. We lost your picture, Senator Hunter, but we do hear you.
Oh,
and we want
okay.
to.
Okay.
I don't know what happened, but we want to thank you again, and we'll be circling back around to talk with you more.
Okay. Thank you very much, guys. Take care.
Okay.
Take
you
very good care.
Thank you. Bye-bye.
Bye bye.
Bye bye.